Hello all. I would like to, this is a continuum class of the last week's basic airway management. Now we get into the topic advanced airway management, in which we'll be slightly brushing up about the airway manuals which we have discussed in the last class. And we will see what the bag mask ventilation, any other adjuncts can be added to improve our bag mask ventilation. And there are other airways which would improve the ventilation, like supraglottic airways, and how to use them. What are the pros, cons of supraglottic airways will be discussed. There are some fundamentals of rapid sequence intubation. Also, we will discuss. And we'll discuss about a failed airway, how to recognize and what are the steps and how to develop a mental model is what we'll be discussing in today's class. Coming to, as we discussed already, oxygenation matters always more than intubation. So what we think is intubation, airway management is mainly focused on putting some gadgets into the mouth is what always understanding is what most of the doctors feel or most of the physicians feel. But it is not putting some gadget across the vocal cords or putting the gadgets across the oral cavity. It is always oxygenation is what is paramount. So maintaining the oxygenation or supplementation of adequate oxygen across the respiratory system is what should be our paramount intention or our goal while managing an airway, any airway. It could be a difficult airway or trauma airway or a normal airway or during the ICU or in the emergency. Our paramount should be to maintain oxygenation. Because why oxygenation is most important? As we discussed, the brain injury happens within 4 to 6 minutes because it will not have any oxygen reserves. The brain tissue will not have any oxygen reserves. So within 4 to 6 minutes of hypoxia or a lower oxygen concentrated blood is being provided to the patient, to the brain starts to apoptosis. So the brain death starts to occur. Brain cell death starts to occur. So that's why the most airway deaths are due to hypoxia, not because of not able to ventilate. It is about hypoxia. The tube placement alone does not save a life. If we take some 5 to 10 minutes in putting a tube, during that time we are not bothered about the oxygenation. Just imagine, we'll have a successful tube placement, but there will be no oxygen during the time taken to put the tube, because our judgment will usually be failing while we are putting a tube, and while it is taking more time or not, we will not be alert of or aware of, which will lead to persistent or a prolonged hypoxia, which will further lead to brain injury or brain death, and we'll have a successful intubation, but will not be able to save the patient. So that's why always oxygenation is more important than intubation.